Well, thank you so much for having me today. It's really exciting to get to meet with this group and talk about a topic that I think is so important and doesn't get enough attention. I will say up front, I think that this is an area, particularly when we talk about farm workers, where we need more research, more knowledge, and more awareness. But what I'll talk about today are some experiences that I have had working with NCFH and with CDC collaborating on this topic and investigating Lyme disease in outdoor workers. And I will also provide some general information and knowledge that I think is important to raise awareness about how to prevent tick-borne diseases and Lyme disease in particular among outdoor workers, including farm workers. And I'll say also, I'm not going to get into detail today on the clinical manifestations or clinical management of Lyme disease, but I think that's coming up as part of this learning collaborative in a future session with Dr. Bethany Alcotter. All right. So tick-borne disease is a big problem, and the majority of vector-borne diseases in the US are caused by pathogens that are spread by ticks. Unfortunately, there's not a lot of good news in the world of tick-borne diseases. In the United States, over recent decades, there has been a steady increase in the number of tick-borne disease cases over time. Cases are being reported over an expanding geographic range, and that's attributable in part to expanding ranges of the vector ticks that carry these diseases. And in addition, an increasing number of organisms spread by ticks have been recognized as human pathogens. And tick-borne diseases are spread by multiple different kinds of ticks. The deer tick, or Ixodes scapularis, or also known as the blackleg tick here on the left, is the most important pathogen, or spreads the most important tick-borne pathogens, including Lyme disease in the US. And here in the middle, you can see the Lone Star tick, or Amblyomma americanum. And on the right, the American dog tick, Dermacentor variabilis. All of these spread different tick-borne diseases in the US and have different geographic ranges. Of the over 62,000 reported cases of vector-borne diseases in the US in 2017, you can see here that the vast majority, 95%, were caused by pathogens spread by ticks. And you can also see here that of all those cases, Lyme disease cases constituted the majority, 68% of all vector-borne disease cases in the US. And this is from 2017, but that's still very true today. After Lyme disease, you can see here the most common reported tick-borne diseases in the US include Rocky Mountain spotted fever, and more discussion and education on Rocky Mountain spotted fever is scheduled later in this learning collaborative, as well as anaplasmosis, babesiosis, ehrlichiosis, and tularemia. So we're going to focus today, because it's such an important tick-borne disease, on Lyme disease. And I'm going to delve a little bit deeper into the epidemiology of Lyme disease and then talk about how we looked at Lyme disease and tick-borne disease risk in a highly endemic area. So Lyme disease is spread seasonally in the US by Ixodes ticks, these blackleg ticks that I mentioned before. And it's very seasonal. So you can see here the majority of Lyme disease cases occur in June and July. That's shortly after the season when the nymphal ticks, so the tiny ticks that you can barely see, are most active. And it's also the time of year when people are most active outdoors and are more likely to be exposed to ticks doing outdoor activities in the areas where Lyme disease is endemic. But as you can also see in this chart, there are cases of Lyme disease that do occur year-round. And Lyme disease is also highly geographically focal. Infections are very heavily concentrated in the northeastern United States, in the yellow states that you can see here. so the Northeastern, Mid-Atlantic, and Upper Midwestern states. And cases that occur in these darker blue states are usually associated with travel to states that have higher rates of infection. The exception to that is the California West Coast shaded region that you can see here is an area where we do see local transmission of Lyme disease associated with the Western blackleg tick or Ixodes pacificus. But the vast majority of Lyme disease cases in the US occur in this highly geographically focal area, 95% of cases. That geographic range is spreading. And so the surrounding areas that are shaded here are areas where we have emerging Lyme disease incidents and increased incidents. If you zoom in on those states, on the areas that are neighboring the higher incidence areas. And the incidence of Lyme disease in the US is steadily increasing over time. You can see here surveillance data that indicate and show that spread. And we see that no matter how we look at Lyme disease using different types of surveillance data, we see this gradual increase over time over the last several decades. Current estimates are that nearly 500,000 people are being treated for Lyme disease annually in the US. So who is at risk for Lyme disease? And why do we care about this particular risk for farm workers or outdoor workers in general? Lyme disease risk depends on outdoor exposure to ticks. And in particular, it's tied to time spent in grassy, brushy, or wooded areas in those highly endemic states. So outdoor enthusiasts, gardeners, and children have been shown in the literature to be at higher risk of Lyme disease. And we also know that there is increased risk in the domestic environment around people's homes. So it follows logically from that outdoor workers may also be at higher risk, but the data are lacking to confirm this. There are some studies, but not a lot of information, particularly in the United States, about the potential increased risk among outdoor workers. And current routine Lyme disease surveillance data does not include information about occupation or occupational exposures. And this is particularly important because outdoor workers are at risk for severe disease or potentially severe outcomes from Lyme disease. And we suspect that there's increased risk there, but also that there's also a missed opportunity to prevent later diagnoses and more severe outcomes. Outdoor workers often experience health inequities, and many lack basic worker protections, things like workers' compensation or health insurance. Outdoor workers in the US include many immigrants, guest workers, non-English speakers, and folks who may have precarious employment. And so we know that in Lyme disease, morbidity can be magnified by delays in treatment. So this is a group where we really need to focus our efforts for Lyme disease prevention. So now I'll share a little bit of what we did to try to look at and better understand Lyme disease risk among outdoor workers. And this was a partnership between CDC and the National Center for Farmworker Health that I had the honor to be part of back when I worked with CDC. We did a rapid community assessment. So CDC brought some subject matter expertise on Lyme disease and bacterial vector-borne diseases, and NCFH brought expertise in engaging the community of outdoor workers, and they led the data collection for this rapid community assessment. We selected 3 counties in northern New Jersey for this assessment, Passaic, Morris, and Hunterdon counties. And these counties were selected because it's a highly endemic area for Lyme disease. We know there are lots of ticks that carry Lyme disease in this area, and also because it is an area that includes a diverse worker population in different outdoor industries and jobs. And this is what it looks like. It's absolutely beautiful farmland, farmland that's bordered by forests. And it's just the type of landscape where you might imagine that workers who are going between farmland and forests would be likely to encounter ticks. It's often on that edge between the farm and the forest where people encounter ticks. And we chose the end of the tick season, that in the downsloping part of the seasonal curve for Lyme disease to do this assessment. So we did the assessment in October so that we could assess tick exposures over the course of the preceding tick season. And we had three main objectives with this assessment. First, we wanted to measure the risk of tick-borne diseases among outdoor workers. And we measured it in comparison to a control group of non-outdoor workers that was a smaller group. And to measure that risk, we used tick encounters as a proxy for tick-borne disease risk. Second, we wanted to describe knowledge and perceptions of ticks and tick-borne diseases among this group to try to understand how best to target raising awareness. And then third, we sought to describe the prevention practices that might protect workers against ticks, such as the use of repellent or long sleeves and pants. And I'll talk more about what those look like, and tools that might be provided by employers for outdoor workers. And we used both quantitative and qualitative methods for this assessment. We surveyed workers who were recruited at community sites, work sites, and residential sites. And then we also did more detailed, in-depth interviews of key informants, including workers and employers and worker advocates. So we brought these great little Petri dishes that have resin and tick samples in here, and these were great conversation starters. We showed people a sample of ticks. These are what different types of ticks looked like. And we asked, in 2022, so this is happening in October of 2022, how many ticks have you found crawling on or attached to your body or clothing? And that's how we assessed tick exposure. And we got all kinds of answers and had lots of good conversations about ticks when we were recruiting and interviewing outdoor workers. One of the unexpected findings that we had from this fieldwork was that people have a lot of different ways of referring to the same insect, or the same, not insect, but arachnid, the same, referring to a tick in Spanish. So used different words like pioja, pioja de monte, araña, chinche de monte. There was a great diversity of ways to say tick in Spanish, and a large proportion of the people we were interviewing were Spanish speaking. But the most common word and the usual translation that we used was garrapata. And I think part of this unexpected finding from fieldwork has really gotten us thinking about how we communicate about tick-borne diseases with Spanish speakers, and just communicating clearly about what bug exactly we're talking about and what it looks like is an important area. We found differences between different occupational groups in the proportion of those members of that group who reported having a tick encounter during that tick season. So it ranged from just 12% of the non-outdoor worker sample we interviewed up to 34% of workers in landscaping, which is quite high. And the findings from the interviews that we had with participants really supported a significant impact from ticks and concern about ticks, particularly among landscape workers. And this interview and quote really stayed with me. We talked to one landscape worker who said, I picked up a fear of working outside and I left work on the grass just because of the issue that I had with ticks. He was so concerned about ticks that he changed jobs. Concern was really high, but knowledge was low among outdoor workers in the group that we interviewed. 80% knew that ticks could spread diseases. 55% were somewhat or very concerned about tick-borne diseases. But when we tried to get a little more granular, only about 18% of those we interviewed had heard of Lyme disease. And this is in a highly, highly Lyme endemic area. So this is a high contrast to other surveys, which have found that more than 80% of people in endemic states are familiar with Lyme disease. This group had a lot less familiarity, looking at outdoor workers specifically. And when we asked outdoor workers about prevention methods that they used, a majority reported that they wore long sleeves and pants for practical reasons, and reported that they showered immediately after coming indoors. A minority reported wearing repellent, checking for ticks, and avoiding the brush when possible. And these are all recommended tick bite prevention methods. And only 10% reported using clothing that's treated with an insecticide like permethrin. Employers provided little information or tools to help workers prevent tick bites. Only 31% said that their employers provided repellent on site. And strikingly, only 15% of employees, speaking of outdoor workers, reported having received information about tick bite prevention from their employers. So that's a really important target for improving awareness among this group at high risk. And 12% said that their employers provided showers on site. So in summary, in this rapid community assessment, we did gather some data to support that outdoor workers in endemic areas are at risk of tick-borne diseases. And particularly in this assessment, it looked like landscape workers had increased risk. Again, I think there's a need for more data for farm workers specifically, but these data do suggest overall an increased risk among outdoor workers. And there also is a need for education and awareness to prevent tick-borne diseases. I think this is really the key. Employers have a responsibility to properly equip and train their workers to minimize workplace threats, including tick bites. And for workers who may have inconsistent employers, creative communication strategies are needed to help equip this group against ticks and tick-borne diseases. And these strategies should take into account language preferences and literacy. All right, now I'm going to switch gears a little bit and share some general Lyme disease education. And this is really the information that I think is important to be shared with outdoor workers and others in endemic areas who may be at risk of Lyme disease due to residence in or travel to endemic areas. So I showed a picture of the tick earlier. And one thing that's important to understand about Lyme disease or about the ticks that carry Lyme disease is how those ticks attach to the body. So they don't jump, thankfully, fly, or drop from trees, but they will sit on the tips of grasses and shrubs, and they'll wait for a host to brush against that grass. That's when the tick quickly climbs on and finds a place to attach itself. Then the tick slowly becomes engorged with blood that it's ingesting. And these ticks will stay on the body for a prolonged period of time while they feed. In the US, again, the only ticks that transmit Lyme disease are these black-legged or Ixodes scapularis ticks. And these are this is a picture that shows the relative size of these ticks compared to a dime. You can see they're tiny, and this nymph on the left here that you see is the life stage of Ixodes scapularis that's responsible for most transmission and Lyme disease in the US. So they're very, very tiny ticks. You may have seen in 2018 this famous poppy seed tweet. It usually comes out around tick season every year from CDC that makes the point about how small ticks are and how easy to miss. And I'm sorry if this ruined anyone's breakfast or enjoyment of poppy seed muffins. So, given how late patients often present for care after a tick bite, tick bites are typically painless and often not noticed. it's important for clinicians to know how to manage and counsel patients after a tick bite. So in this section, I'll review what to do or how to counsel folks who present or who you encounter after a known or suspected tick bite, and how you can determine if a patient might benefit from Lyme disease post-exposure prophylaxis. And that's a medicine taken to prevent the development of Lyme disease after a tick bite. So this is a picture that shows an attached Ixodes scapularis nymph tick. And this is an enlarged photo. We talked about how tiny these ticks actually are. That's what they look like when they're attached. And as a tick feeds, it grows and becomes engorged with blood. So you can see here, after 72 hours, the tick has tripled in size and is even larger after 96 hours. That's when someone's more likely to identify that they have a tick on their body. But at that point, the tick has already been on for a prolonged period of time, and the likelihood of transmission is greater. Lyme disease is not transmitted immediately after a tick bite when that tick attaches, but it happens as through the process of the tick remaining attached and becoming engorged with blood. The tick also injects its saliva into the bloodstream or into the bite site, which can carry Borrelia burgdorferi, and that's the pathogen that causes Lyme disease. So the biggest thing that can be done to prevent transmission is to remove ticks promptly when they attach. And so that's where the importance of tick checks, finding ticks who may be attached after spending time outdoors, and then promptly removing those ticks when they're attached comes in. And these are the steps to remove a tick. If anyone's lived in an area where ticks are prevalent, you've probably done this many times. But what's recommended is to use fine-tipped tweezers to grasp the tick as close as possible to the skin's surface. And then to pull upward with steady, even pressure, not twisting or jerking the tick so that the mouth parts come out. And then finally, after removing the tick completely, cleaning that bite area and also cleaning your hands with rubbing alcohol or soap and water. The area where the tick bit should really be thoroughly cleaned, and that's to prevent infection. I want to share a tool that CDC developed called the Tick Bite Bot that I really love. This is sort of an early AI for ticks, though it doesn't actually use AI technology. But the Tick Bite Bot is available on the CDC website, or if you Google Tick Bite Bot, it's the first thing that comes up. And it's an interactive tool that will assist folks in removing attached ticks and knowing when to seek healthcare and when they might be eligible for post-exposure prophylaxis for a medicine after a tick bite, again, to prevent the development of Lyme disease. So this Tick Bite Bot is accessible, it's easy to use, and you just chat with the bot and it will tell you what to do. But I'll review briefly here some of the reasons that we would encourage post-exposure prophylaxis after a tick bite. It's important to understand that this is specific to Lyme disease. Most tick bites, thankfully, do not transmit disease, and antimicrobial post-exposure prophylaxis is not effective to prevent diseases other than Lyme disease. But after a high-risk tick bite, post-exposure prophylaxis to prevent Lyme disease may be appropriate in the right situation. There's a decision-making aid that is available on the CDC website that helps with that decision-making after a high-risk tick bite. You can go through this in detail on your own, but the important takeaway here is that PEP, that post-exposure prophylaxis, is most likely to be beneficial when it's given after a high-risk bite by a black-legged tick, shortly after that tick is removed. The sooner the post-exposure prophylaxis is administered, the more effective it's likely to be. And for adults, the dose for Lyme disease post-exposure prophylaxis is a single 200 milligram dose of oral doxycycline, so usually 2 small pills. For children, that dose is about 4.5 milligrams per kilogram orally, up to a dose of 200. And it's important to note that the short courses of doxycycline are safe to use in children of all ages. The AAP, the American Academy of Pediatrics, came out with some helpful data and recommendations in 2017, 2018, updating their recommendations to say that it's safe to use short courses of doxycycline for children of all ages. So benefit outweighs uh, the any potential risks, though those risks are very, very low in young children. One common thing that comes up when talking about tick bites is a question of whether ticks should be tested for pathogens. And this is not recommended as a diagnostic tool for tick-borne diseases. It can be interesting for pathogen surveillance, for general public health knowledge, but in general, tick testing results should not be used as a proxy or to substitute for tick-borne disease testing in patients, and can lead to overtreatment, unnecessary antibiotic use, and unnecessary anxiety. So if someone is evaluated and is determined not to be a good candidate for post-exposure prophylaxis with doxycycline, what is recommended at that point after a tick bite in an endemic area? Well, symptom watching, observing closely for symptoms, for fever, rash, or malaise in particular with Lyme disease. And that observation is most important over the month after a tick bite. Most people will develop symptoms during that first month. The other thing to think about in counseling someone who's received a tick bite is future prevention. People who had one tick bite are likely at risk of being bitten again. So always take that opportunity to provide counseling about how to prevent future bites. And the effective ways to prevent tick bites are to use EPA-registered insect repellents, daily tick checks after being outdoors, showering or bathing within 2 hours after coming indoors, putting clothes in a dryer on high heat after coming indoors to kill ticks, avoiding tick habitat, preventing tick bites in your pets, and also reducing tick habitat through yard management. And these are all, I think, relevant to outdoor workers and also to their employers to think about how these can be adapted for a work environment. And lastly, this is just a picture to show you where ticks like to hide: on the scalp, around and in the ears, under the arms, inside the belly button, around the waist, between the legs, and the backs of the knees. So when we're talking about doing tick checks, those are the high-risk areas where ticks are often hiding. And so demonstrating or showing someone who is at high risk how to do a tick check can be an important piece of education. Outdoor workers have a significant burden of occupational hazards in general, and many lack consistent access to healthcare. And we have reason to think that they're also at higher risk of tick-borne diseases, including, importantly, Lyme disease. And so as we're thinking about Lyme disease prevention overall in the US, it's important to keep health equity at the front and center and think about how we communicate creatively and prioritize prevention tools, for example, Lyme disease vaccines, and post-exposure prophylaxis for folks who are at highest risk. Lastly, I'm just going to share this reference manual for healthcare providers. This is a resource if you're ever wondering about tick bites or tick-borne disease epidemiology or some high-level clinical management, diagnosis and management of tick-borne diseases. This is a manual that the CDC publishes that can be found at this website, cdc.gov/ticks. That is a great reference for not just Lyme disease, but varied tick-borne diseases. And